Thank you, Barbara. My presentation is going to be very brief and very informal. I wanted to start out by thanking everybody for having me here and saying what an honor it is to see all of these people and their family members and their friends who are surviving with myeloma and who are out here to learn some more. I see several people that I know out in the audience, and my favorite part of my job is getting to know people and just watching the strength that they exhibit when they're dealing with a disease like this. So I've been asked to talk today a little bit about the role of a mid-level provider in providing care for a multiple myeloma patient. I wanted to start by asking if you could show your hands if you or your family member or loved one has ever seen a physician assistant or a nurse practitioner throughout your cancer care. Raise your hands if you have seen one. So that's a pretty good percentage. That's changed a lot since I even started. How many of you, can you raise your hands again, feel like you understand what that person's training is or what their job is or what they're there to do for you? Quite a few less hands, which is kind of what I thought. So that's what I'm here to talk about today. I am a physician assistant, and this is not to be confused with a medical assistant. We have medical assistants who also perform very valuable tasks around our office. They will get your vital signs. They can participate very much in your care. But this is a slightly different thing. I have a master's degree, so I first got a bachelor's degree, and then I went through 7 semesters of grueling school that I'm still paying for. I got done in 2001, and then I spent some time in clinical and classroom training. Physician assistants are trained with kind of a broad base, so you could go into any area of medicine, and a lot of your specialty and your learning will occur in the first few years of your job. Physician assistants have to pass a national exam, so I have a C at the end of my name, and that means I passed. So if you don't have a C at the end of your name, then maybe you didn't, I don't know. So the job of a physician assistant is to work as part of a healthcare team. I have a very unique and interesting job at Mayo Clinic. I'm primarily a multiple myeloma physician assistant. I have 5 physicians that I work with at the Mayo Clinic, Dr. Stewart, Dr. Bergsagel, Dr. Fonseca, Dr. McHale, and Dr. Reeder. Some of those may be your physicians, and most of them work almost exclusively with multiple myeloma and related diseases, and my job is to be a part of the team with them. We actually sit in a room during our workday where it's myself, the physicians that are working that day, and the registered nurse that works with our team as well, and we're freely talking throughout the day about patient situations, about research developments. My job is very interesting because I get to prepare people for transplant. I work as an outpatient, but I will see people during their chemotherapy, explain the side effects of the chemotherapy, monitor them for how they're feeling, and answer any of their questions. And then when they come out of transplant, then I get to assist them through that recovery process, which has been mentioned earlier, and watch them recover and regain their strength. Individual duties of a physician assistant might depend upon their experience. There are physician assistants in neurosurgery. I would recommend if you're having your brain operated on that I not do the procedure. That's not what I do. So a lot of it's individual training. Physician assistants can work in all areas of medicine. In our clinic, we also use nurse practitioners as our mid-level providers, and they have trained us in PA school to tell us about why PAs are better than nurse practitioners, and my nurse practitioner friends have said that they have been trained about why they're better than physician assistants, but my colleague, the other hematology mid-level provider, is a nurse practitioner, and I love working with her, and we really perform an interchangeable role. One reason that I think it would benefit to use a mid-level provider in your practice is that I'm here to answer your questions. We've heard from a bunch of excellent physicians, and as you know, with their training and their experience, they have a lot of different things pulling on their time. And my job is to kind of explain it to everybody. If you have something that you don't understand, I want you to tap me on the shoulder and say, hey, what does this mean? They told me about some clone in my bone marrow. What does that mean? So my job is to kind of put that on a real practical level, and also to try to take care of the whole person. I realize that you're more than just an M spike, and so any kind of symptoms that you're having, whether it's emotional symptoms during the treatment process, physical side effects, or if you just came down with a cough and cold and you're concerned because you're on chemotherapy, then those are things that I can often see you for on the same day. I'm also privileged to participate in clinical trials, and some of the great drugs that were mentioned in some of the earlier presentations I've actually been able to give to patients and to study the side effects along with the physicians. We do sit routinely. Every week we have a meeting which is specifically for patients with multiple myeloma, where we'll discuss certain cases, how we should treat those things and why. So I don't want you to feel that if you're seeing a physician assistant or a nurse practitioner that they're just out there on their own and that the physician is not responsible for your care or isn't concerned about your care anymore. So basically, I am very lucky and honored to have the job that I do. I'm very lucky and honored to work with those of you with multiple myeloma and your families and friends, and I will be available later for any questions or at any time in the future. Thank you.